Hey guys, welcome back. This one's going to be, this was actually a pretty quick presentation. This is going to be over pharmacology or general pharmacology, or I think our textbook calls it principles of pharmacology. It doesn't really matter, but we're just going to go over like drugs. Drugs that the EMT can give, and then drugs that the EMT are going to be exposed to. So just don't think about the aspirin and the epi and the activated charcoal and the oxygen, and the oral glucose, stuff that we can give. Think about the stuff that we're going to be exposed to that people have taken and they've called us because they've taken them, such as Prozacs, antihypertensive, so medications that make your blood pressure high. Other types of other types of classifications of medications. Okay, here's a couple terms. Pharmacology is the study of drugs and how it goes in, and the medication or drug is the compound that creates the drug, and the drug is to help prevent or treat any abnormal condition or disease. Pharmacology is the study of the nature of that. All right, here are some drugs that EMTs can administer. Start off with our oxygen. Woo woo, yeah. This is our oxygen tank right there. We can give up to 1 to 15 liters. Nasal cannula, non-rebreather, BVM, your choice. Kind of a buffet of oxygen. And then we got our aspirin. Aspirin is very important for those people with chest pain. We got our oral glucose, and then our activated charcoal. These are common medications that the EMT will actually carry and actually give to patients if they are warranted. Okay, these are some medications that the EMTs are going to be around. We may assist with administering these. We won't have these on our ambulance. Like, we don't carry nitroglycerin, we don't carry albuterol, we don't carry EpiPens, but patients might have them, and they might ask us for assistance with giving them because they're too nervous, they don't know how to do it. So those are some medications that we might be able to assist them with. Notice it says prescribed MDI, and some people are like, what's an MDI? That just stands for meter dosed inhaler. So that means when that Proventil, which is an albuterol type drug, which is albuterol, when they push down, they're going to get a certain amount of that medication every single time they do one push down. That is a metered dosed inhaling. Okay, we have two different names that you guys really need to know. You got your generic name and then your trade name. The generic name is like the simple chemical form of the name of the drug. So, perfect example is a drug called diphenhydramine. Wow, that sounds like a really fancy word, but it's really just another word for Benadryl. It gets marketed as Benadryl. They think Benadryl sounds sexier for marketing, so they call it Benadryl, but at the end of the day, it's just diphenhydramine. Indications and contraindications. This is important to know. An indication is the reason on why we give a drug. A contraindication is why we should not give a drug. If a person has a contraindication, they don't get that drug. So this is one of those big things that we need to pay attention to. If they have a contraindication to this drug, they just simply do not get it. Okay, here's some forms of medication that's going to come in. Our most common, most obvious is gas, aerosol, that's our oxygen. And then you got like your liquids and suspensions. Think of that as your activated charcoal. It actually has to be constituted with water. It's like a black dust. It gets constituted with water and then it made into a liquid. And then you got your solids and gels. That's like your oral glucoses. Okay, a dose. This lady is taking one hit. Okay, a dose can be administered, and it's a dose. It's whatever one dose is. Think of it as one spray of nitroglycerin is 0.4 milligrams. So we can give up to 3 of those. So we can give a total of 1.2 milligrams of nitroglycerin. The dose is one spray, which equals 0.4 milligrams. Albuterol, the dose is 2.5 milliliters of albuterol. The dose for epinephrine is 0.3 milligrams. So that's just the different dosages. As EMTs, we really don't need to worry too much about dosages because we can't give too many medications. Most common dosage we'll have to give is aspirin. Basically, it's 4 baby aspirin, so it's a total of 324 milligrams. Nitroglycerin, you don't need to know what each spray is. You just need to know that you can give up to 3 sprays. Oral glucose, the dose of that is usually the whole bottle, the whole little tube. Okay, routes of medication we can give is oral, sublingual, inhaled, injected, or intramuscular. Oral is just taking a pill. Sublingual is something you'll give like nitroglycerin, so it goes underneath the tongue. If you guys use any of those like Listerine breath mints, they go underneath the tongue. They basically just dissolve under the tongue. Inhaled oxygen. Injected is like your IVs. And then intramuscular is what our EpiPen is. It actually goes into the muscle. There are some other forms of medications, but not medications witnessed by the EMT. The only other one that's witnessed by EMTs, and this is when you're working with paramedics, is called IO. It's called interosseous. And that means we go right into the bone. And when we go into the bone, it actually goes into the bone marrow. So you might see that one as IO. You get IV, IM, and IO. Those are just different routes of delivery of the medication. EMTs will never give it through the IO. You guys just might see paramedics do it. It's very common in cardiac arrest. Okay, IVs. You guys typically won't be worrying about IVs. The main purpose we have IVs is to give blood, give fluid, or to give drugs. Usually an IV line is just a catheter goes into the vein, and then it's usually just normal saline, a TKO. That's just dripping enough to just keep it open so it doesn't clot. You guys won't mess with it. You guys really won't even transport one with it, but if you do, just make sure it drips. If it doesn't drip, just turn it off. And when you get to the ER or wherever you're going, just let them know that you don't notice that it's not flowing. Like I said, probably won't be transferring many people with IV lines just as an EMT. If you have a paramedic with you, they'll take care of that. Flow rates, like how much we adjust it. If you see that guy, he's got his finger on that little dial. That means he's opening it up. That means he's increasing the flow rate. And then taking it down, we'll pinch it off and slow it down. And basically when paramedics determine the amount of rate, it's based upon how much fluid they need per hour. But a lot of times we'll just do it like a very small little drip, and that's just what we call TKO, or keep vein open. Some complications we run into when we have IVs is infiltration. So if we get that IV and instead of going into the vessel, we go into the interstitial fluid or the intravascular fluid, intravascular spaces, and we put medication in there and fluid, that's going to cause a hematoma and swelling. If you put like a sugar in there like D50, it's going to cause necrotic. So we always must be alert to make sure when we do have an IV, it's flowing patently and into a vein and not into the interstitial fluids, interstitial space. We need to start worrying about blood clots in the lungs. We need to worry about fluid overload, especially with patients that have dialysis or can't excrete any of their fluids. They are very sensitive to any type of fluid going in. So if we give them a liter of fluid, we are really screwing them over because they have no way of getting rid of that. And then we might be able to just always pay attention to the line might stop running. That might be because of the way they have their arm flexed. If they have the IV in the middle of their arm and their arm is moved up, of course it's not going to run. Or if the blood pressure is taking a blood pressure cuff or taking a blood pressure, it might not be running when that blood pressure cuff is filled up. All right, when we take medications, the reason we take it is called, we want to find the action, and that is what it does on the affected organs. So if it's antipyretic, which means it decreases our fever, it's going to find the place and help us decrease our fever. Side effects are things that we get because of it. Most common side effect is probably going to be nausea and vomiting. Pretty much any medication could always make anyone feel nauseous. So it's just a common side effect. And then a drug interaction is very bad. It means that one drug is influencing or interacting with another one in an unwanted manner. And the area where the EMT comes in most common or most familiar with this is if we want to give nitroglycerin to a patient, but they take the erectile dysfunction drugs like Cialis or Viagra or the Blue Chew, well, they cannot receive or they should not receive nitrates for chest pain for 24 to 36 hours just because there is a drug interaction that can be non-desirable if those two drugs interact with each other. And that non-desirable effect is very low blood pressure. Can't begin to tell you how important this is. You must know your at least these 5 rights. Your textbook has like 8 rights. There's a bunch of different rights, but these are the main ones that I care about when giving a drug. It has to be the right patient, right drug, the right dose, right route, and right time. Okay? Right patient, right drug, right dose, right route, and right time. We will always, when we get an order, read it back to the physician or nurse that gave us that order so we can have that secondary confirmation that they know the exact drug, dose, and route, and when we intend on giving that drug. Anytime you give a medication, you must document the patient, the time you gave it, vital signs before and after medication, if there were any anticipated effects, if there's any change in condition, or if there's any side effects. You must document all that. Anytime you give a medication, there should be a full set of vitals before and a full set of vitals afterwards. You just always can be safe by doing that. If you're going to give nitroglycerin, the blood pressure must be above 100. Take a blood pressure before, take a blood pressure about 2 minutes afterwards. All right, our old people and drugs, just know that they can take a lot of medications and they can see a lot of different doctors. So they do have the ability for those drugs to have very poor interactions. They constantly or commonly take a drug called beta blockers. Beta blockers will slow down your heart rate. So if this little gangster granny gets a little bleed, an internal bleed, typically our heart will increase when we have an internal bleeding. But if somebody's on a beta blocker, it won't necessarily increase. The heart rate can't increase because the beta cells are being blocked. So those are just some things to be able to pay attention to with old people. Always find out what medications they're on, see what they are, see how they work, see what's been working, what hasn't been working. You're going to ask a lot of questions about medications that all these patients are in, and you'll learn a lot in the field. Okay, this is a big one. If you make a medication error, which they happen, provide any type of patient care that needs to be given, contact medical control, let them know what you did, follow any of the protocols, and then make sure you document it honestly. Talk to your partner, supervisor, and the medical director. This happens. Medication errors are very common. They're avoidable, but they do happen. I mean, you got to think of how often medications are given every day all across the United States. Errors will happen. So if they do happen, I wouldn't say it's a big deal. It is a big deal, but you're not going to get in trouble as long as you're honest and you were working and you had the right intentions. And one more quiz before we leave. Which of the following medication route has the fastest effect? Oral, intravenous, subcutaneous, or intramuscular? Now this question only has one line, so I don't need to reread a bunch of lines. But anytime I take a quiz, I always reread at least the last sentence of that question. Which of the following routes of medication administration has the fastest effect? For this one, it's intravenous. Orals still got to get absorbed through the respiratory mucous membranes and then go into the digestive system, into the circulatory system. Subcutaneous has to go through the layers of the skin. Intramuscular has to go through the medicine, has to go through the muscles, and then into the circulatory system. IVs are always going to be the fastest. All right, guys, that was a really quick down and dirty general pharmacology. You guys really need to know the dosage of a common dosage of nitroglycerin. Just know how it's given, how activated charcoal is given, how oral glucose is given. Just know the indications and the contraindications of those medications. Review those and make sure you have a good grasp on those. If you guys have any questions, just give me a holler in class. Peace.